people who have severe skin diseases, nobody wants to touch you. People will ask you if it's
Yeah.
contagious. Children stare at you. So
Yeah.
it affects every day of your life, like your whole, when you walk out the door, everyone knows you have a
Whoa.
medical condition.
First, let me say welcome to Black Women's Health. I'm Dr. Rahman, and I am a board certified OBGYN. In this episode, you will discover three things. One, what are the presenting symptoms of seborrheic dermatitis? Two, what Black women need to know about seborrheic dermatitis and their hair care. And three, what is the latest treatment for seborrheic dermatitis and why is it important for Black women to know about this? I have two guests who will share their experience and their expertise. Let's get started. I am very happy to have two very special guests with me tonight, Dr. Heather and a patient of Dr. Heather, Grace, Miss Grace. Welcome to you both.
Thank you.
So let me just say a little bit more about Dr. Heather. Dr. Heather is a board certified dermatologist and is also certified in lifestyle medicine. She is recognized internationally, is involved in clinical research. Pleasure of having a patient of Dr. Heather who is a brave female who will share her personal story. Welcome, Grace.
Thank you for having me.
All right, Grace. We're talking about a very sensitive topic.
Yes.
It has to do with beauty and how we see ourselves and how other people see us. And you were diagnosed with a skin condition called seborrheic dermatitis. Is that correct?
That's correct.
All right. Tell us the story. What did you first notice?
Good.
What made you think that you had a problem?
So I first started experiencing symptoms of sebderm early on, even before I developed my sense of self as a young lady, as a girl. So, my first memory is 8 years old, and I was called into the nurse's office with a bunch of other kids in the class. And there was a lice outbreak, and they were checking our scalps for lice. And so I didn't have lice, but I remember I still feel the energy, the frequency from the nurse that was checking my hair because she paused and there was whispering and there was concern. And the feet, and they sent a note home, but I can't tell you exactly what was said and what the note said, but from that experience, I knew that there was flakiness in my hair, dry scalp, and the message to my parents was she needs to wash her hair more often. And that just marked me around how I saw myself, of self-worth, and how really dealing with beauty and appearance from a young age. So I didn't have an official diagnosis until I was 12 years old. I remember going to dermatologists often because after I would get treatments, and after a while they wouldn't work, and I was in a dermatologist often. And of course, around that age, puberty, going into teenagehood, I was hyper conscious about it, and my mom was really good about keeping me in front of a doctor.
Question for you. You were 8 years old and this was seen at school.
Yes. Yes.
Had your mom mentioned anything about your hair was it primarily your hair that was the concern?
At the time it was primarily my hair, and I recall like around my hairline I had a lot of discoloration. I actually, if you go back and look at pictures from school, you see the discoloration around my hairline. And I don't recall anything my mom might have said, but I do. So my aunts did my hair I would go to my aunt's house and my grandma's house for the weekend, and they did my hair for the week. There was three girls, and my mom worked a few jobs, so she wasn't in my hair every day. I
Mm-hmm.
guess what they would call a protective style these days.
Mm-hmm.
I either had cornrows or four
Mm-hmm.
flats, something
Mm-hmm.
in between the hair for the week or a few weeks. And so I know I didn't have that feedback from my mom around the scalp because she wasn't in my scalp every day.
Okay, but at 8 years old, you got the distinct impression that something was wrong.
Yes, that something was wrong,
And what
and
did,
I was doing
what
something
did,
wrong.
what did you do about it, or what happened after that?
So that really began a cycle of seeing specialists, seeing dermatologists, and that ranged from because the flare ups would vary. At that point, when it first started, it was in my scalp, it was in my hair area. But over time, I started to see symptoms, redness, and the symptoms look like redness or flakiness, some hyperpigmentation around my eyebrows, around my nose, um, even around my mouth area and my chin. Another problem area that doesn't happen as regularly, but inside my ears. So as different symptoms would pop up, I was in and out of dermatologists seeking different treatments, anywhere from shampoos to creams to um, different types of steroids.
Was it spreading, or you mentioned your hair first, and then you mentioned your face? Any other parts of your body?
Mostly in the facial area, the hair, which we know was again as a team, we're just super problematic for me wanting to fit in and look cute, frankly. But really, just my scalp and my face area and my ears. So nothing. I know that other symptoms can give themselves in other parts of the body, but for me, it was just the face area and my scalp.
And the symptoms were flakiness, you mentioned
Redness,
discoloration.
coloration, and um I mean the flakiness was like yellowish or grayish. It was it does for me it kind of it stands out, especially when it's around your hairline. It can look like dandruff, but for me it was just a little bit more um aggressive than your dandruff. I went to one of many doctor's appointments and I finally got some. It was helpful because I finally got some clarity around the issue and I knew how to treat it. And still, I got to tell you, I'm in my mid 40s. From 12 to my mid 40s, it was just a cycle of different treatments. Because again, after a while, some things wouldn't work for me, or
Hmm.
different they say, I think Dr. Heather will tell you that extreme weather can impact it. I've been told a lot that stress can contribute to it. So I never knew how to anticipate a flare up or an issue.
Dr. Heather, question for you. What is seborrheic dermatitis?
So seborrheic dermatitis is a very common condition, usually on the scalp, but as we just heard, it can affect also the face, behind the ears, and it's an inflammatory skin condition that's thought to be a reaction to yeast on the scalp. So it can be a reaction to the normal amount of yeast, or it could be an overgrowth of yeast, but it's thought to be this abnormal inflammatory response to yeast, and you see itching, burning, scaling, flaking, all of these symptoms on the scalp. But as mentioned, it can also happen in the eyebrows, usually sometimes even right between the eyebrows, behind the ears, in the ears in more severe cases, right around the crease of the nose is a very common location. And then the lower face can have seborrheic dermatitis. And in men, we can sometimes see it on the chest. So it's a very common condition. It can affect we think up to 10 million Americans, and it's something we see as dermatologists all the time.
When you say yeast, I think of the yeast vaginitis that women come into the office. Are we talking about the same thing?
Totally different. So, our skin's microbiome is different based on the location, right? And different things grow. But if in moist areas, we have overgrowth or growth of different types of bacteria and types of yeast. So on our scalp, we have a yeast called Malassezia. It's common. And but it's it's a normal flora, the normal yeast that is supposed to be on our skin. I always emphasize to patients, this is not an infection. I always
Mm.
emphasize this. This is not an infection. It's an abnormal response to yeast that's on your skin.
What causes that?
The inflammatory response, we don't know exactly why some people develop seborrheic dermatitis, whereas others don't. It's just something that, but we do think that it is an inflammatory response to yeast because seborrheic dermatitis can sometimes be treated with antifungal shampoos. That's what's available over the counter. And so that's one way to manage it, or the more direct way to manage it is to manage the inflammation.
Grace,
Yeah, yeah,
tell us, were
yeah.
your symptoms, you mentioned flare-ups, were they related to stressful situations
Mhm.
in your life or no correlation at all?
That's a great question. It's hard to know for sure, but I do think there's a connection between stressful situations and the flare up. I often notice after the fact, and I'll think, oh, okay, this was a tough week, and growing up, uh, we had some stressful situations, and I think I internalized a lot. So I can't say for sure, but it sure does feel like it in my experience.
Back to you, doctor. Grace said that she had to try different treatment options because they stopped working. Is that what you're saying, Grace?
Yes, over time they would be ineffective.
So what is the treatment and why do some options stop working?
So the treatment, well, first of all, when people have the flakes or scale on their scalp, Grace is very lucky. She was actually diagnosed at a very young age. But most commonly, people will try over-the-counter treatments, and it takes most people quite a long time to get to the dermatologist because it's not something that people commonly talk about. I always describe acne as an example where everyone knows that if your acne doesn't get better with over-the-counters, you see a dermatologist. But with the flaking and scale, the itching and burning, and all of the symptoms on the scalp, and as I mentioned, also sometimes on the face, people will try other things. So patients are more likely to try the over-the-counter products that are available. And most of those, as I mentioned, are antifungal. So they contain ingredients like zinc, parathyroid, or they contain selenium sulfide, or they contain ketoconazole. Those are the most common shampoos that are available over the counter to treat this. But also people will resort to, just recommendations from a hairdresser. There was a period of time where people would put apple cider vinegar, and I would see patients who were trying that. Lots of home remedies, lots of friends saying to try this thing, try this different product, change to this hair oil, try this. So I find that in my practice, patients often have tried not only traditional over-the-counter products, which are antifungal shampoos, but also have tried a lot of home remedies. And it takes people a little bit longer to get to the dermatologist. Once you do get to the dermatologist, we have some treatment options available. In the past, we used to use a lot of topical steroids because, as I mentioned, this is an inflammatory skin condition. So one of the main ways dermatologists will treat inflammatory skin conditions is with topical steroids. The main issue with topical steroids is that seborrheic dermatitis occurs close to the face. A lot of people have it on the frontal hairline or in the eyebrows, around the nose, and we do avoid using topical steroids on the face. So this is something that was a challenge, definitely for me as a dermatologist when a patient presented, because I'd have to give very specific instructions not to use it close to the face because we don't want the side effects that we can sometimes see, like acne is a common side effect of topical steroids. Now, I'm really excited because there's a new treatment. Actually, I've partnered with Arcutis to talk a little bit about a new treatment for seborrheic dermatitis. And it's really exciting because it's the first treatment in over 20 years. It's called Zoryve, and the generic name is roflumilast. And the reason why I'm excited is because it's steroid free. So it's a steroid free foam, it's lightweight, it's compatible for all hair types. It doesn't have drying alcohols, which is a big problem for my patients because my patients tend to have curly, textured, coily hair, and a lot of the topical shampoos and topical treatments were very drying. So this new treatment, Zoryve, is alcohol free. It's a once daily foam, so it's really a great treatment option. and it works on the inflammation. It's a PDE4 inhibitor, which it targets a very specific pathway of inflammation and is very effective for seborrheic dermatitis.
Okay, I have a couple questions.
Yeah.
First question, should my hairdresser be able to recognize seborrheic dermatitis?
I think most hairdressers know when there's something wrong, and Grace can tell us what her hairdresser says. But my patients will often come in and say, my hairdresser saw XYZ, whatever it is. So I think the hairdressers, there's a partnership, honestly, between dermatologists and hairdressers, because hairdressers often will tell patients, listen, something is wrong with your scalp, and I think you need to see a dermatologist. So
And
a
should,
hairdresser,
I'm sorry,
yeah.
go,
A
please
hairdresser
continue.
may not necessarily give the exact diagnosis, but will recognize there's an excessive amount of flaking, scaling, redness, sensitivity, and direct their client to see a dermatologist.
And should I, as a patient, avoid getting my hair relaxed or getting braids or some hairstyle because of this condition?
So that's a very complicated question. It's a very complicated answer. I would definitely think for relaxers will aggravate. So if you have active seborrheic dermatitis, that means your skin barrier is compromised. That means that your skin is not intact and it will have significant burning if you put a chemical on your skin. So definitely with relaxers, if a patient is in a flare, it would get significantly worse. And I don't know, Grace, if you ever had relaxers at one point. I know your hair is natural now. What was your experience with that?
Yeah, oh, I have, oh, yeah, very, very deep and sometimes traumatic experience. I don't know if you remember Dr. Heather, but the first few times I would see you and I would ask you, should I be getting a relaxer? Because I have been natural for about 12 years, but before I was natural, I was getting relaxers, and the internet wasn't prevalent back. There wasn't a whole lot of information around, and my hairdressers would say, you just need to grease your scalp more. And before you get a relaxer, coat your scalp with grease so that the chemical is not touching, because my scalp would scorch. I would actually I would have scabs. It was really traumatic experience for me. I actually had to stop getting a relaxer out of utility. It happened around the time where a lot of people were just going natural, but I just out of pure utility because I was literally getting burnt and it hurt. It hurt. And
So, Grace, I have a question
yeah.
because you were diagnosed at a very early age. So, I would imagine when you went to the hairdresser, you could tell her, I have seborrheic dermatitis.
I did not make the connection that young. So I was getting chemicals in my hair. I think I was around 10, and it wasn't a relaxer, but it was some sort of texturizer to make it to loosen the curl pattern. And but that's the reaction from, we called them the Jerry curl back then. The reaction from the Jerry curl was much different from a relaxer. It was a much different. And so as a teenager, I was getting relaxers and I wasn't making the connection. And my response was, I just gotta prepare better. And also just, they would say you have a tender scalp. So I would just, I would suck it up and endure it. And try to do things that mitigate it, like not sweat too far in advance, because if it was already, your scalp's already exposed and you sweat. And when I decided to stop getting relaxers, I was a runner. And so I was, when I would have a flare up and I would sweat and I would get a relaxer, it was super painful. And so I love that question about whether hairstylists should be able to recognize subderm, because that would have really helped me back, a decade ago when I was enduring all that pain and I wasn't making that connection.
And I do want to mention for other hairstyles, I've had patients say that when they get braids, depending on the type of hair, it can aggravate the scalp because the hair has chemicals on it that can be aggravating. So I've definitely had feedback from my patients that certain hairstyles can aggravate it, specifically relaxers for sure, just because that's a chemical, and when you have seborrheic dermatitis, your skin barrier is not intact. But also with braids, because if the hair is chemically treated, it can aggravate the seborrheic dermatitis. So I've definitely seen patients complain about that.
If I have excessive dandruff, could I possibly have seborrheic dermatitis?
So that's a great question because we hear that term dandruff, and sometimes we'll use dandruff and seborrheic dermatitis interchangeably, but really, dandruff is a symptom of seborrheic dermatitis. So, seborrheic dermatitis is the inflammatory skin condition that leads to the burning, itching, scaling, and tenderness on the scalp. Sometimes rashes. In darker skin types, in lighter skin types, a rash can be reddish. In darker skin types, it tends to be hyperpigmented, especially around that frontal hairline, or hypopigmented. So dandruff are the flakes and scale that are a symptom of seborrheic dermatitis. Seborrheic dermatitis is an inflammatory condition. Dandruff is like the symptom, which is the flakes and scale that we see clinically.
I am trying to put this together. If I have excessive dandruff, I should probably try to see a dermatologist.
Definitely. Then it's highly likely that you have seborrheic dermatitis.
What about could it be eczema or psoriasis or some of the other skin conditions that I have? Do they all look similar? Or
They look similar, but there's a few ways we can distinguish, and that's such a great question. So for eczema, some people will have some symptoms of their eczema on the scalp, but those people will also have the classic findings of eczema, which would be itching in the angle of the elbow here, behind the knees, a family history of eczema, allergies, hay fever, or asthma, a personal history of one of those things, asthma, allergies, and hay fever. So that is usually easier to diagnose if you get a full history and you look for other signs of eczema. For psoriasis, the scale is usually thicker, silvery. Usually we describe a silvery scale with psoriasis. Psoriasis tends to be on the back of the scalp, the occipital scalp. And again, patients with psoriasis will have psoriasis on other parts of their bodies. So they're likely to have elbows and knees, thick silvery scale, or a family history of psoriasis, or a family history of other autoimmune conditions. So, because psoriasis is an autoimmune condition. So, how dermatologists distinguish eczema versus psoriasis versus seborrheic dermatitis is really that full clinical picture.
do you have to do a biopsy for diagnosis?
No, it's really a clinical diagnosis and it's usually very straightforward. People with seborrheic dermatitis will have scaling on the scalp, will ask about the eyebrows, will ask about around the nose, the chin. Those things are so specific that it's very easy to diagnose clinically.
Is it harder to diagnose in Black women?
It can be a little bit challenging because we do a lot of processes to our hair. So it might be a Black woman may be more likely to say, "Oh, I just had a bad perm," or "I just had," I might be directed in a different direction. For me, it's very straightforward. Again, it's a straightforward clinical diagnosis, but I could see how maybe if there was some buildup from product use or something else, it could be a little bit confusing, but for someone like me, it's very straightforward to diagnose in Black women.
Grace, I have a question for you. Looking back on your journey with seborrheic dermatitis, how stressful or how disruptive was it to your life on a scale of 0 to 10, and 10 is the worst that you can imagine?
Oh, okay, okay. I've never got this question. I would have to say, I would have to say eight. You know,
8.
you know why I say eight? And this is one thing I appreciated about Dr. Heather and this partnership with Therese. There's a real acknowledgement of the social factors that come along with it. So there's the condition, and then there's the impact socially. Because I didn't what this experience helped me to realize is how much I had shrunk as a result of what was going on in my scalp and my skin. Again, for me, I started to see the symptoms at an early age, and so I had just really just shrunk into a small version of myself because I never knew when I would see flakes on my shoulder that I couldn't control because I was having a flare up, or I would, have some outbreak on my face, or, sometimes it peaks around my hairline, like little embarrassing moments that make you feel not so pretty, or that that you worry about the perception of you. So that really spilled over. That's why I rate it so high, because again, it's not just merely flakiness. It's how that kind of shapes your self image, and how it affected how I showed up in the world, socially, at work, in my dating life. So yeah, so pretty big, pretty big.
Well, you look beautiful tonight.
Oh, thank you.
In retrospect, would you have done anything differently on the journey of being diagnosed or in terms of treatment for the seborrheic dermatitis?
I wish I had access to a doctor that focused on skin of color early, because I wasn't able to have. I felt like my questions about what to do with my hair, or the fact that the shampoo prescribed was dried out, it made me feel like it was really a petty concern, a small concern. And some of the doctors wouldn't entertain it. They're like, this is what mitigates it. This is what you do. And so we didn't get to the questions about social impact, what it did to my hair, relaxers versus natural. This past few years are the first time I'm having these conversations. And so
Wow.
I felt like I can't complain about that. This is not terminal disease. Let me just deal. And so this is the having the flex, not just giving the space to actually talk about my whole self and not just the diagnosis, is huge.
So, what I'm hearing you say is that you might go to a dermatologist that can diagnose the seborrheic dermatitis, but then can't tell you how to manage it in terms of your hair and all those other type of things.
Yeah, if I could say it another way, going to a doctor that treats the whole person is makes a difference. Yeah.
Back to you, Dr. Heather. What would you tell women who have this condition? What do they need to understand?
So I love that Grace brought up the social aspect, because it does tremendously affect quality of life. And I am a big proponent of acknowledging that, because I feel like sometimes women feel like, well, it's just flakes and scales and I shouldn't be worrying about it so much, but it does influence so many things. We know severe skin disease has a tremendous impact on quality of life, greater than many things that you think would impact quality of life more. So I really try to, first of all, validate my patient's feelings. And I would want a woman who's suffering with seborrheic dermatitis to know her feelings are valid, and it is extremely disruptive, and it can affect self-esteem. And no one wants to have, flakes all over their shoulders. And, teenagers who have this in high school, the person sitting behind them is thinking, what's all over your shoulders? People think it's contagious. They don't want to touch you. It really can affect your quality of life. So first, I would want someone watching who is suffering with subderm to understand that their feelings are valid, and it's okay to be upset, angry, frustrated with this condition. I would want them to know that there are great treatments available, and to see a dermatologist, because you don't have to just keep cycling through over the counter treatments and, something your neighbor gave you, and try this and try that, because there are treatments that are effective and actually work. So that would be something else that I would want someone who is watching to understand, to feel empowered that there is something that you can do to help manage this condition.
Does it ever go away? Or will I
It,
need medication all my life?
so yes and no. So I had seborrheic dermatitis. As we mentioned, it gets worse with stress. I had it the worst during medical school, pretty severe behind my ears, had burning and stinging on my scalp. It was very significant. I was a medical student. Since then, I have little flares here and there, but nothing major that compared to the way it was when I was in medical school. So does seborrheic dermatitis go away completely? No, it does tend to come and go. People with more significant severe disease, like Grace has, are more likely to have significant flares throughout their life. I had milder seborrheic dermatitis, so it doesn't really bother me too much now, but I could have a flare, out of the blue in a month, a year, and 5 years. So it is a chronic condition. It comes and goes. For some people, it stays its course, throughout the lifetime. And for other people, they can have little flares at different points in their life.
I know someone is wondering, what is the holistic treatment for this? Can I use castor oil or
I would say I consider myself a holistic doctor. I definitely think I'm a big picture person. I would say there's over the counter kind of home remedies tend not to be as effective, or they're effective for a short period of time and then they stop working. And it's a question of, did it really work, or was it just your flare kind of went away? Because remember, it's a disease that kind of goes like this. But I do think there are interventions that we can do. So holistically reduce and manage stress. This condition definitely gets worse with stress. It is not caused by stress. People who have sebderm are predisposed to have this condition, but stress definitely makes it worse. As I mentioned, I had this during medical school. I think we were both pretty stressed when we were in medical school. So managing stress, and I talk about stress management. I always recommend to my patients meditation apps, which are a very simple way, guided meditation. And they have studies that show that even 5 minutes of guided meditation can have an impact on our stress levels. Just disconnecting, putting down our phones for 5 minutes is, very, very helpful. And then all inflammatory diseases, whether it's eczema, psoriasis, seborrheic dermatitis, we do think that diet can play a role. So eating healthy, just like we should always be eating healthy. So eating foods that are anti-inflammatory and avoiding foods that are inflammatory, like processed foods, lots of sugar, are likely to help inflammatory skin diseases. We have studies for sure for things like eczema and psoriasis, less studies on the diet for seborrheic dermatitis, but in general, we know that inflammatory skin diseases can be aggravated or are associated with diets that are highly inflammatory. So lots of sugar and processed foods. And that's just common sense, so I always say what's good for us on the inside is good for the outside. So those are the things that I would say holistically would be lifestyle changes. That doesn't mean that if you ate healthy and you avoided all stress, you would never have sebderm again. But I definitely think that stress definitely aggravates seborrheic dermatitis, and managing stress may help to control some flares. May.
Well, that was very informative. That was very informative. I want to thank you both for taking the time. I want to thank you, Grace, for being brave enough to share your story with us. Thank you so much.
You're welcome.
And Dr. Heather, thank you for all the information. Is there anything that you want to say in parting?
Well, I just want to thank you so much for having both of us, because this is such an important disease. I think that it's something that we haven't talked about as much. As a dermatologist, there are certain diseases get lots of airtime, acne, for example, and anti-aging and all of these other things. And this is something that tremendously affects patients' quality of life. And I think that a lot of times people suffer in silence. So I think that raising awareness about seborrheic dermatitis is so important. So people go out, get treated, so that you don't have to deal with this condition. And there are really effective treatments available.
Thank you. Grace, any parting words?
Sure, I'll say a little bit. Again, thank you for having this platform. I think it's really important to help destigmatize. Like, I'm just getting to a point in my mid-40s where I can talk about it and realize I didn't do anything wrong. It's a chronic disease, and more importantly, there's a treatment to mitigate. I have a streamlined routine. I did all the natural things throughout my life, but I'm really grateful to be a part of this partnership with Arcutis and to have a platform just to kind of reduce the shame and let folks know there's freedom. It doesn't have to be damning.
So there's hope. There's definitely hope. We definitely need to, if we have a problem, we definitely need to see a dermatologist.
Definitely to have access to this very new treatment, which I am excited about, because it's the first new treatment in 20 years. So this is something that Zoryve, or the generic name is roflumilast, is something that is for someone who treats seborrheic dermatitis and is a specialist in skin of color. This is a treatment that's alcohol-free, that is compatible with coily, curly, textured hair, which is something that's new for me in my practice because I really didn't have access to treatments that were very compatible with my patients' hairstyles and hair texture. So this is a very exciting time for something that's so common. To not have anything FDA approved for 20 years is unusual. So thank you again for raising awareness.
Tia, one more before we go. That sounds like a major breakthrough. Can you spell the name of this medication so that someone listening can take it to their dermatologist and ask about it?
So it's called Zoryve. It's Zoryve, and the generic name is roflumilast, and it comes in a lightweight foam that's steroid-free and alcohol-free, so compatible with coily, curly, textured hair.
Thank you both. Have a great evening.
Welcome.
Take care.
Thank you.
Take care. Okay.
Yay. Thank you.
It was good. It was good.
It was great. I think that